In this lesson, I'm going to be explaining the process of labor and your role in providing care for a patient during this process. So in this process, there is a maternal role and a fetal role, and they work individually, but come together jointly to be successful. So the mother's role is going to be known as the 4 Ps, and it is powers, passageway, passenger, and psych. And then the fetal role is known as ALPS, which was with 3 Ps, and that is attitude, lie, presentation, position, presenting part, and station. And these are going to be part of our assessment process during labor. So let's look at that. All right, so first, our 4 Ps, the maternal assessment piece. So powers, they are either voluntary or involuntary. Voluntary are things that she has control over. So that's going to be things like her pushing, how effective her pushing is. Involuntary, she has no control. And that's going to be things like her contractions. She doesn't have control over that, but they are part of the powers to successfully deliver. Then our passageway. So this is basically the pelvis and the relating structures. So just the space that the fetus has to come through. So how much space or room do we have is what's going to be assessed. Passenger, we have 2. We have a baby and we have a placenta. So that's the things that are coming through the pelvis for delivery. And then psych, our emotional state. So does she feel supported? Is she scared and fearful? So we recently had a patient just the other day deliver that was 15 years old, and she kept saying over and over how scared she was. And it really plays a big role. It makes labor, it prolongs labor when they feel like this. So it took her longer to deliver because she had this immense amount of fear. So just helping that psych and making sure that they feel supported and are not scared. All right, so our fetal assessment is the ALPS, that 3 Ps. So first, our attitude. So attitude is going to describe the fetal head. Do we have flexion or extension? Flexion is going to be what we want to see, and that is going to be chin to chest, versus our extension, which is not as normal, thankfully, because it is harder to deliver a fetus like this, and that is where the head is just extended. We don't have the chin to chest. The lie, this is looking at the relationship of the spine. So the maternal spine to the fetal spine. Are we longitudinal, which would mean, the spines are parallel to each other. So we have a maternal spine and then the fetal spine is in line with it. Or is it transverse? And that's where it's perpendicular. So we have a maternal spine and then a fetal spine laying sideways is our lie, our transverse lie. Presentation. So what is the position? Is it head down, where we would say cephalic, or vertex means head down? Are we breech, where that would mean that we have the head first, or sorry, not head first, our butt first, or maybe even a foot, just so we don't have the head first. Do we have a shoulder as a presenting part? So what is trying to come through that birth canal first? What's our position coming down? And then our presenting part. So which part is leading the way? So again, it could be our head, our shoulder, our side, foot, abdomen. What is the presenting part? Our fetal position. So with this, this is the term that's used to describe the position of the baby in relation to the mom's pelvis. So first we have to assess what the presenting part is. So is it a head, which would be the occiput? So that back of the head. So occiput is usually, is going to be when our head's first. So is it the occiput that we see coming first? Is it a scapula, which would be our shoulder? And that would be labeled for this, which I'll show you. It's going to be SC. So it's our O. Chin or mentum is described as an M for mentum. Is it a sacrum? And that would be labeled as S. So for this, what's our presenting part? Looking at this, our presenting part is going to be, we have our head first and our occiput here. So we would label that as O. Then which way is it facing? So facing means mom's pelvis, and we're not looking at the face, we're looking at our presenting part. So our presenting part, our occiput, is facing. We have the maternal side, so left, and her right side. It is facing her left side, so that would be described as L. So we have left siding occiput, and is it anterior or posterior? So anterior means it's more towards the front, which means closer to delivery or delivering. So that would be A. If it was posterior towards the back, then it would be P. So our occiput's more towards the front, so it's labeled LOA in this situation. So what's important to remember is that it's not our left or right, it's the maternal left or right. And that goes first. And then our presenting part, which here is an O. If we saw a sacrum coming out, then it would be an S. A scapula, hopefully that wouldn't happen, but that would be SC, or our mentum would be, our chin would be M for mentum. And then if it's anterior or posterior. Station. So this describes where the fetus is located in the pelvis. So our ischial spines of the pelvis are going to be 0 station. And then as we get closer to delivering, we would either be +1, +2, or +3. Now, this is measured in centimeters. So if we said that the patient was at +1 station, it would mean she was 1 centimeter below those ischial spines. If the fetus is above the pelvis, then it would be described, same thing, measured in centimeters, -1, -2, -3. Just think of it is that the positive is as the fetus is coming out, because that's a positive thing. It's good that the fetus is coming out. So that's our positive, and our negative means the fetus is higher up above the ischial spines. And then 0 station is right at ischial spines. All right, our therapeutic management is going to revolve around helping the mom to feel comfortable during her labor process. So how to focus her powers, how to focus her energy, reposition for comfort. And her psyche, so making her feel supported, or helping her support person to make her feel supported. Medication, so this could be, might be giving Pitocin to help strengthen those powers, make those contractions stronger, and it could also be pain management medication. Our education that's needed is going to be how to focus her energy. So how to push when it's time to push, or how to conserve her energy between contractions. And then how to push. So she needs to hold her breath and keep that breath in for 10 seconds for each contraction. Our nursing concepts for a patient in the labor process is going to be reproduction and comfort. We need to make her feel comfortable during the process to help make everything go smoother. All right, let's review our key points and bring all our pieces together. So the 4 Ps, that's our maternal piece. Our 4 Ps are going to be our powers, our passageway, our passenger, and our psych. ALPS with our 3 Ps there is going to be our attitude, and this is our fetus, our lie, our presentation, the presenting part, and our position, and our station. And then remember their individual roles. So the mom and the fetus each have separate roles that are going to unite to make them successful together. Make sure you check out the resources attached to this lesson, review the different stations and the presentation, because these are usually some test questions. Now go out and be your best selves today, and as always, happy nursing.